Next up, a session from one of our underwriters, AbilTo's CEO, Michael Laskoff. Michael is totally fascinated by the notion that you have to prove things medically, mentally, and financially. And as he said to me this morning, if it's good business, it's probably going to work. He's here for a conversation with Atlantic Media Strategies Managing Director, Lymari Morales. Lymari and Michael, over to you.
Thank you.
Thank you for having me.
Well, we just heard in the last session from Dr. Emanuel that behavioral health is the next big thing. That's exactly the business that AbilTo is in, and helping use behavioral health to keep patients out of the hospital after a major life event, such as a heart attack, diabetes diagnosis, other chronic condition diagnoses. Michael started AbilTo after his own ADHD diagnosis in 2008. So tell us about that gap between medical health and behavioral health that you identified that led you to start this business.
I found out I had ADHD at 37, was shocked that I had lived in a place like New York that I would never know. And I started asking really basic questions like, what is good enough in behavioral health? What is quality? Who can provide quality? How will I know if it's working? And how will I know when it's finished? When I couldn't find answers to any of those questions, or I thought I've just described marriage actually, that what I should really start to do is I should really start to think about if there are best practices, how can those best practices be applied in a way that A, makes people healthier, and does so in a way that is probably less expensive than hospitalization, a device, a medication. That was kind of the impetus for getting the company started.
Great. And your program uses technology and remote coaching to help patients when they're going through a life transition. Tell us about that.
Yeah, and in fact, I should say that I want to apologize to all the people who are wearing remote devices right now. It's not that kind of technology. We use technology to make providers better, to improve their quality, such that they provide better service to all of the patients. So consistent quality to an area that has frankly not had that previously, which means measuring things on the one hand. And on the second hand, we have this marvelous remote technology, obviously now called the internet, but it's actually much less used than this other marvelous technology that we have called telephones. The simple fact of the matter is you can reach people using those devices in a way that they're comfortable being accessed at home throughout the entire United States, and you can do it today. You don't have to change any laws. You don't have to change any business practices.
One of the key differentiators of your approach is that you're using non-medical professionals for these coaching sessions. Tell us about who is delivering the coaching and how that works.
So we use a combination of therapists and coaches working together. And I tell people it's like when I was in high school and took calculus. I had a calculus teacher, and I wasn't really very good at it. And I had a calculus tutor. One of them taught me math, one of them taught me to pass math exams. And the two of them, working together, were able to help me to affect a very particular end in a fixed duration of time that was quantifiably measurable. So we use an LCSW, a therapist, and a coach for an 8-week program that's fixed with a clear beginning and middle and end for populations that have very consistent needs. So 1 in 4 heart patients leaves the hospital with major clinical depression. 80 to 90% of the time that person gets no diagnosis and no treatment. When you alleviate the depression, when you actually intervene with that audience and actually alleviate the depression, you cut the cost of medical care by about 50% annually. And by the way, you can prove this. You don't have to take our word for it. This is the kind of thing, and I'm quite proud, I think actually extremely proud to say, that the American Journal of Managed Care just published an article that we co-authored with Aetna that shows that people who go through this kind of program compared to a very well-structured comparison group saw about a 1/3 decline in the number of hospitalizations in the 6 months following the trigger event and about a 50% decline in the average number of days that they were going to be in the hospital for any reason. No pills, no devices. What we did was we taught people how to affect better self-care in a way that they were completely comfortable with, and we were able to reach enough people to generate truly material savings. And you know, my whole shtick is about if it's economically self-sustaining, then you can actually help large groups of people.
Can you tell us the story of a patient who, embodies the impact that a program like this can have?
Yeah, it's a terrible example, but probably the number of people in here who have diabetes is probably higher than we'd like, and we all know people. We actually had a patient, or a citizen, or whatever we're going to call them, who in fact had been diabetic for a long time, was on the verge of being hospitalized by his doctor because he was so badly regulated. We actually were able to find what the underlying cause of the problem was on a behavioral basis and get him to change it. And the basis was this: he'd been diabetic for something like 5 years and never told his family. So he was continuing to eat in the same fashion that had made him sick in the first place. And simply by doing something that sounds incredibly obvious, of actually teaching people, for example, to self-advocate with their doctors, with their families, with their friends, so that they actually know how to talk about their condition, it's one of those sorts of things that it seems obvious, but if you've not had to do it before, you might not know how. So that would be, this individual did not go into the hospital. His blood glucose levels dropped for the first time in 5 years to an incredibly acceptable range. And this may be a man who didn't have a foot amputated because of the fact that he was able to tell his daughter. That's very different than a medical intervention.
I know in your study with Aetna, you proved that readmissions declined as well as hospital days. You were also able to examine the impact on overall cost. What was that impact?
There was a lawyer someplace staring at me saying, "Don't say anything now." But I would say it's this. It's in the seven-figure number on a monthly basis for just Aetna, for just cardiac patients. These are people, what we're in the business of doing is we are in the business of alleviating unnecessary human suffering, which, by the way, goes hand in hand and I should ask, can I ask anybody who's been in the hospital, put your hand up just for a moment and keep it up. Keep it up if you wanted to spend more time there. So if the answer to that is no, then in fact, our mission is totally aligned with actually the economics, which is preventing people from having unnecessary care, and actually better health. And by the way, the rocket science is this. Instead of teaching people, because we spend all this time, the internet is wonderful, behavior change, saying, why don't you take better care of yourself? Let's help you learn to alleviate those things that prevent better self-care. Leads directly to better self-care, and hence less requirement for unnecessary medical intervention.
So how do people get access to this program, and how many have been able to use this program so far?
Right now we have anywhere between probably in the neighborhood of 1,500 people at any one time nationally going through the program. And that's through Aetna, we're dealing with all 50 states, and we're signing up some of the blue plans. We just announced something with a federal employee plan that will be national hopefully by the end of this year. So we have an awful lot of people going through, but at the core of this is a very simple idea. You are not your own best advocate on the day or the week or the month following one of the most traumatic experiences of your life, whatever that may be. So rather than ask you to have a heart attack, go home, read everything you possibly can, identify the fact that, for example, that your behavioral health might be suffering, and then actually go find the right person to help you with that, why don't we just call those people, since we collectively, AbilTo, working with its health plan partners, knows who those people are and when those events are happening. And instead of asking a 55-year-old man living in Central Texas who's never been in therapy and never will again probably, to self-identify, why not call him and say, you know what, you're not crazy. You're just like everyone else who's had this incredibly awful thing happen. How would you like from home to benefit from something that your health plan covers, that no one need ever know about if that's a concern to you, that you do on a schedule of your own choosing, that's specifically not about getting you over depression, it's about getting you over a particularly tough time in your life. So to make these things work, you've got to change the language, you've got to change the idea of access, and you've got to change what we expect of people.
Yeah, let's talk a little bit more about barriers. Barriers to access, barriers to adoption. What are some of the barriers to making this more commonplace?
Cost. If you've just had a heart attack and you have a $20 copay and you're seeing $4 a week and you make 50 grand a year, you're not doing this sort of thing. Self-identification, another huge barrier. Geography, another huge barrier. The way the laws are written so that you can't, from a telemedicine or a telehealth standpoint, easily cross state lines, there are ways around it. We built networks in all 50 states, but that's not something that many organizations can do. So best practices don't tend to move. Those are things we all need to look at.
Great, thank you. That's actually all the time we have, but thank you very much.
Appreciate it.